everyone. Thank you for joining today's MIPS Improvement Activities Performance Category in 2019 Year 3 webinar. The purpose of this webinar is to provide information about the Improvement Activities Performance category of the Merit-Based Incentive Payment System, MIPS, for the 2019 performance year of the Quality Payment Program. Now, I will turn the call over to Katie Moore, Health Insurance Specialist in the Center for Clinical Standards and Quality at CMS. Please go ahead.
Great, thank you, and good afternoon, everybody on the phone. We really appreciate y'all joining us today for our webinar, as we just said, on the Merit-Based Incentive Payment System, so MIPS, Improvement Activities Performance category for the 2019 performance year of the Quality Payment Program. And throughout the webinar, you might hear us refer to 2019 performance year or year 3. Those mean the exact same thing. So just want to let y'all know up front. Our discussion today is on improvement activities, which will round out our MIPS performance category webinars for 2019. But don't worry, if you've missed our other webinars that were focused on our quality, cost, or promoting interoperability performance categories, don't worry. They are all, you can find all of the recordings, slides, transcripts for those on our website, qpp.cms.gov. under the webinar library link at the top of the page. So for today's topic, I'm joined by Angela Foster, our lead for Improvement Activities Performance category, as well as several of our other subject matter experts that are on the line, ready to help answer questions in our chat box as we go through our webinar today and you hear all this important information about improvement activities today. So we're going to hopefully answer a lot of your questions along the way through the chat, but at the end we will open it up and check out our chat for questions so that we can respond to some more trending ones that we see along the way. So just a couple of housekeeping items before we get started. The first is, like I said, we'll do our best to cover as much as we can today as possible, and we'll answer as many questions as we're able to get to in the time that we have. But don't worry, all of the slides, the slide deck, the recordings, and our transcript will be posted on the webinar library on qpp.cms.gov. Usually we do that within 2 weeks of the webinar, so keep a lookout for that. We also encourage everyone, if you haven't done so already, to please sign up for our Quality Payment Program listserv. It's really simple to do this. Just go to qpp.cms.gov and scroll down to the bottom of the page, and you'll be able to, you'll see a subscribe box, and you can enter your email address, and that's really the best way to stay up to date with all of the information that we're putting out about the program or anything new. So we really encourage everybody to sign up if you haven't already done so. Next slide, please. And one more. Great, thanks. So here we just have our topics for today. So we're going to go over, just really briefly, I'll go through an overview of the Quality Payment Program. MIPS, we'll go over just some basics about the program as a whole. And then I'll hand it off to Angela, who will go over some basics, reporting requirements, data submission information, and scoring about the Improvement Activities Performance category. And then we will close our webinar with some more information about resources, technical assistance that's available, and then we will open it up to respond to some Q&A through the chat. Next slide, please. All right, as a refresher, for those on the line who participated over the last 2 years of the program, or for any of those who are newly eligible, what you're seeing on the screen is the general structure of the Quality Payment Program. And you'll see this graphic throughout a lot of our materials, our fact sheets, and different guides. So we like to just remind people about the structure of the program, where we are required under the Medicare Access and CHIP Reauthorization Act of 2015 to implement the Quality Payment Program, which consists of the 2 tracks you're seeing on the screen, the Merit-Based Incentive Payment System, so known as MIPS, or the Advanced Alternative Payment Models for clinicians who are interested in earning additional incentives for taking on additional risk related to patient outcomes. So now our focus today is really on the MIPS track of the program. So we're just going to take, on the next slide, we're going to take a few minutes to review just some high-level elements about MIPS specifically. And again, if you're interested in learning more about other aspects of the program or the advanced APM side of the program, please check out our QPP resource library for additional materials or some more webinars we have in our webinar library. Next slide, please. Great, thanks. So as we have displayed on the screen, MIPS is comprised of 4 performance categories. For those who are newly eligible to the program or you're participating for the first time, those performance categories are quality, cost, promoting interoperability, and as we're talking about today, improvement activities. So quality, cost, and promoting interoperability performance categories are similar to some of the previous legacy programs. You may have noticed some of those similarities in these different categories. So when we launched the quality payment program in 2017, the improvement activities category was really a new focus. So one that we want to make sure everyone is really comfortable with today, and you know all you can about that performance category and participate fully. So additionally, all 4 performance categories add up to 100 final points. We will assign a final score for each MIPS eligible clinician, and that final score can range from 0 to 100 points. What we then do is compare your final score to what we call a performance threshold, which is essentially the minimum amount of points a clinician must receive in order to avoid a negative payment adjustment. So comparing the final score to the performance threshold will determine if a clinician receives a positive, a negative, or a neutral payment adjustment in 2021. So everything we do in the 2019 performance year will be reflected in our 2021 payment adjustment. So just so you're all tracking, the performance threshold for 2019 performance is 30 points. So you must receive at least 30 points in order to avoid a negative payment adjustment in 2019. So again, reflected in that 2021 payment adjustment. Next slide, please. Great, thanks. So we often get the questions, how does CMS determine if I'm included in MIPS for the 2019 performance year? So first we start by identifying if you're a MIPS eligible clinician. So for 2019, MIPS eligible clinicians include all the ones you see listed on the screen. So physicians, physician assistants, nurse practitioners, clinical nurse specialists, certified registered nurse anesthetists, clinical psychologists, physical therapists, occupational therapists, audiologists, speech-language pathologists, registered dietitians or nutrition professionals, and then groups that include these different clinician types. So I just want to flag, several of the clinician types that you'll see on the screen on the right-hand side are new clinician types for 2019. So just wanted to point out that we have several new resources available on the QPP resource library that is really geared to these new clinicians to help them figure out what measures or improvement activities they might want to select that are specific to how they practice. So if you'll see a number of if you use the filter on the resource library, you'll be able to select specialty guides, and then the different guides will show up for these different clinician types. So I encourage everybody to go check that out, and it'll list the measures that really apply to those clinician types as well as the improvement activities that are most applicable to those specialties. And just as a quick reminder, the definition of physicians includes doctors of medicine, doctors of osteopathy, so including osteopathic practitioners, doctors of dental surgery, and doctors of dental medicine. Doctors of podiatric medicine, doctors of optometry, and chiropractors with respect to certain specified treatments. So a doctor of chiropractic is legally authorized to practice by a state in which he or she performs that function. So just a little more background when we say physicians, those are the types of clinicians we are referring to. Next slide, please. Great. So we then look to see if you exceed all three elements of the low volume threshold criteria during a specific determination period. So we look to see if you bill more than $90,000 a year in allowed charges for covered professional services under the Medicare Physician Fee Schedule, or PFS, and furnish covered professional services to more than 200 Medicare beneficiaries. And then the third element of the low volume threshold is that you provide more than 200 covered professional services under the PFS. So you're included in MIPS and are required to participate by submitting performance data. So if you meet all three of these, if you exceed all three of them during a specific determination period, then you are required to participate. So if you do not meet the criteria that's listed on the screen here, and again, we'll have these slides available so you don't have to furiously write down all of these different criteria, and we also have them in a lot of our materials on the resource library. If you do not meet the criteria listed here, then you are excluded, which means you are not required to participate in the program. Now, there are a couple of options for 2019 for those who are excluded, including not participating, so you're not required to participate. You could opt in, or you can voluntarily participate. And we have some really good resources. I don't want to go into too much detail on those because I know people probably have some questions, but we have some materials on our resource library that will explain each of those in greater detail. Next slide, please. Thanks. So finally, this is just a quick diagram to illustrate the timeline for MIPS. So as you can see, we're currently in the middle of the 2019 performance year. So you should be collecting data. So first, figure out if you're eligible for the program. And if you are, or you choose to participate and you want to opt in or voluntarily participate, you should be collecting data across the performance categories. So I also want to encourage everyone to, if you participated in 2018, so go ahead and sign in at qpp.cms.gov. And right now, you can already review your preliminary performance feedback from 2018. So if you submitted data, want to know how you did last year, figure out if you should do the same thing or try something different in 2019, your performance feedback is available to preview right now, so you can go ahead and check that out. But just note that our final feedback will be available this summer. So with that, I am going to go ahead and turn it over to Angela Foster, who's going to take us into some more detail specifically about improvement activities.
Thanks, Katie. Hello, everyone. Thanks for joining today. I'm Angela Foster. I lead the Improvement Activities Program here for CMS. I want to thank you again for taking the time to listen to our presentation to learn more about the Year 3 policies for improvement activities. And on behalf of the Improvement Activities team, I would just like to say that we're really proud of the work we've completed to develop a meaningful program that allows eligible clinicians to report on improvement activities that are most relevant and meaningful to their practices. So let's go ahead and dive right in. Next slide, please. Here's a little snapshot of what improvement activities looks like in 2019 as far as what percentage it's worth, for your total MIPS score, you may be pleased to learn that we have not made substantial changes to the policies for this performance category for year 3. As you can see here, improvement activities are still worth 15% of the MIPS final score in 2019. Next slide, please. Improvement activities continues to assess participation and activities that improve clinical practice. The minimum performance period is still a consecutive 90 days. So this can include any 90-day period within the calendar year January 1, 2019 to December 31st, 2019. And each activity can be reported only once during the 12-month performance period unless otherwise specified within the improvement activity description. Next slide, please. Clinicians can participate in an APM or choose from 118 activities under the remaining 8 subcategories. It is not necessary to pick activities from each of the subcategories or to choose a set number from a certain number of categories. Also, we do not mandate the activities you need to perform. Our hope is that this will make it easier for you to choose activities that are relevant and meaningful to your practice, as I mentioned previously. And here you can just see a listing of the subcategories and their titles. Next slide, please. While we didn't make a lot of changes to the policies, the most significant changes we did make for 2019 were made to the improvement activities inventory. For year 3, we've added 6 new improvement activities within the Achieving Health Equity, Beneficiary Engagement, Integrating Behavioral and Mental Health, Care Coordination, and Patient Safety and Practice Assessment subcategories. And you can see those improvement activity titles here with their activity IDs for your reference. You would be able to look those up on the QPP site to get a more detailed description for each one. Next slide, please. We also made some modifications to 5 existing improvement activities for the 2019 inventory, and they are listed here, again, with their improvement activity titles and IDs. During our analysis of the IA inventory, we also found it necessary to remove one population management improvement activity because it was duplicative of another improvement activity within that subcategory. And that those improvement activity IDs are referenced here for you as well. Next slide, please. So now let's take a look at reporting requirements. Next slide. Again, no big surprises to those of you already familiar with the improvement activities performance category. We are in year 3, so a lot of you are probably pretty familiar with how it works. But for those of you who are not familiar, I'll just go over this very quickly. The improvement activities are weighted as either medium or high. Medium weight activities are worth 10 points, while high weighted activities are worth 20 points. You will receive double points for each high or medium weighted activity submitted if you have any of these special status designations. That would be a small practice, non-patient facing, rural, or underserved practices. So just to be clear, I'll explain how this works. Double points means each medium weight activity would be worth 20 points, and each high weighted activity would be worth 40 points for those who have been determined to meet that special status designation. Next slide, please. So here we go into a little more detail on how this looks for special status versus non-special status. MIPS eligible clinicians will have fewer reporting requirements for improvement activities if they qualify for one of these special statuses that I just mentioned. So if you're in a small practice, which would be a TIN consisting of 15 or fewer eligible clinicians during the MIPS determination period, or if you're in a practice located in rural areas or in health professional shortage areas, if you're a non-patient-facing clinician, if you participate in an APM or a MIPS APM, and if you're in a practice that is certified or recognized patient-centered medical home or comparable specialty practice. Technically, that's not really considered a special status, but you would be able to qualify for credit in the improvement activities category. When reporting as a group, I just want to note this for you, or a virtual group, your small practice non-patient-facing rural or HPSA designations must be granted at the group or virtual group level to qualify for the reduced reporting requirements that I just described. Specifically, more than 75% of the National Provider Identifiers, or NPIs, billing under your group's tax identification number or virtual group's TINs must be designated as either non-patient-facing, rural, or located in a geographic HPSA. Non-patient-facing determinations are made using claims and PCOS, Medicare PCOS data analyzed during the two segments of the MIPS determination period. Rural area and geographic HPSA determinations don't use the MIPS determination period. Next slide, please. Participating in a patient-centered medical home or comparable specialty practice can earn you 100% in the improvement activities performance category. In the first year, for those of you who may be familiar and have already participated in the program, we required at least one practice site within the group's 10 to be certified. In year 2, or performance year 2018, we bumped that up and required at least 50% of the practice sites within a group's 10 to be certified in order to receive credit. And I just want to make clear that this IA improvement activities credit is not granted automatically. Practices will still need to attest to their status as a patient-centered medical home or comparable specialty practice to receive the full credit. So again, the credit is not granted automatically. You would still need to attest to your status to receive the credit. Next slide, please. If you're a MIPS-eligible clinician participating in an APM that is not a MIPS APM and is not scored under the APM scoring standard, you can get credit for participating in an APM and receive at least 1/2 of the total points, so that would be 50%, for the MIPS improvement activities score. You will need to select additional improvement activities to achieve the highest score. MIPS-eligible clinicians identified as participating in a MIPS APM are scored under the APM scoring standard and are assigned an improvement activities score. Next slide, please. Now let's talk a little bit more about scoring and how the points you earn in improvement activities contribute to your score for the category and to your MIPS score overall. Next slide, please. This illustration here outlines how the improvement activities performance category is scored. The improvement activities performance category, as I've mentioned already, but it's worth repeating, is worth 15% of your final score in 2019. The way it works is your improvement activities performance category points are multiplied by the 15% improvement activities performance category weight. The result is then added to the other performance category scores to determine the overall MIPS final score. Improvement activities can contribute toward no more than 15% of your final score, even if you submit more than 40 points worth of activities. Next slide, please. On these next couple of slides, we've provided a few scenarios to further illustrate how your final improvement activity score could look based on what you might decide to report. So on this particular example, if you choose one medium weight improvement activity, that would give you 10 points total, or 25% of your available improvement activity points. You would then multiply your 25% improvement activity score by the 15% improvement activity weight to get a final improvement activity score of 3.75%. Next slide, please. Now in scenario 2, we look at how you would be scored if you chose to report one high-weighted activity and one medium-weighted activity. This would give you 30 out of the 40 total possible points, or 75% of the available points for improvement activities. Your final score would then equal 11.25%. Next slide, please. This last scenario here is fairly straightforward and demonstrates reporting for an eligible clinician designated as a special status. So here, that clinician would select one high-weight activity, and that would give them 20 points or 50% of the available points in IA. Once you multiply that by the category weight, you would reach a final score of 7.5%. Next slide, please. Okay, excuse me. Now we will move on to how you can submit your improvement activities to CMS. Next slide, please. Beginning with the 2019 MIPS performance year, MIPS eligible clinicians, groups, and virtual groups may submit improvement activities data using multiple data submission types, provided that the individual clinician, group, virtual group uses the same and consistent identifier or identifiers for all performance categories and all data submissions. Next slide, please. The following submission types are outlined here, and they are direct. This would be where individuals, clinicians, groups, virtual groups, and third-party intermediaries can perform a direct submission. They would transmit data through a computer-to-computer interaction, such as an application programming interface. Another method would be login and upload. This allows individual clinicians, groups, and virtual groups and third-party intermediaries to upload and submit data in the form and manner specified by CMS with a set of authenticated credentials. Currently, this occurs on the QPP website, qpp.cms.gov. You can also log in and attest, and this is where individual clinicians, groups, third-party intermediaries, and virtual groups with a set of authenticated credentials can log in and manually attest to their improvement activities data directly on the QPP website. Next slide, please. Those of you new to the program may be wondering, how exactly do you attest? Well, to attest, you will just answer yes to each improvement activity you have completed that meets the 90-day requirement. If you're in a group or virtual group, you can attest to an improvement activity as long as one clinician in your group or virtual group participated in the activity for at least 90 continuous days during the performance year. We've provided a link here on this page to the improvement activities data validation criteria, which is a useful guide that provides additional instruction on what we would accept for data validation. This information is outlined for each improvement activity in the inventory. Next slide, please. To receive credit for the Qualified Clinical Data Registry Improvement, sorry, I'm getting tongue-tied, Qualified Clinical Registry Data Improvement Activities, you must perform the improvement activity for a minimum of a continuous 90-day period and attest to the improvement activity during the submission period if using the login and attest submission mechanism. Or you would need to have your QCDR submit the specific improvement activities on your behalf, and you must note, please, that simply participating with a QCDR and having them submit data for the quality or promoting interoperability performance categories does not satisfy any requirements for the improvement activities performance category. Next slide, please. Now I'd like to turn your attention to the resources, help, and support CMS provides. Katie mentioned that a little earlier in the presentation. Let's go to the next slide and take a look at what we offer. You'll see here that we provide many no-cost options to help clinicians participate in the quality payment program. Based on your circumstances, you can choose to receive assistance from a variety of sources. As always, we provide information about the quality payment program on our website as a starting point, and that's the qpp.cms.gov that I mentioned earlier. Our resource library is where our fact sheets and documents like the MIPS data validation criteria can be found. You can also have your questions answered by contacting the Quality Payment Program Service Center, either by calling directly or submitting your questions via email. Next slide, please. Just a few things to note and mention here for your information. Each year we hold an annual call for improvement activities. This is where stakeholders, including clinicians, professional organizations, researchers, consumer groups, and others, can identify and submit new improvement activities or modifications to an improvement activity for consideration in future years of MIPS. And you can find the forms and the information on how to do that on the QPP website. Improvement activity nominations submitted between February 1st, 2019 and July 1st, 2019 will be considered for calendar year 2020 rulemaking cycle for possible implementation starting in calendar year 2021. Submissions received after the July 1st deadline will be considered for future years. Before we go on to the next slide, I just want to call your attention to the note at the bottom that proposing a new activity is completely voluntary and not a requirement of participation. We do appreciate your submissions, but it is not something that's mandatory. Next slide, please. There are some additional resources available on the qpp.cms.gov website. You can also take a look at the Explore Measures and Activities page, and the shopping cart tool provides a lot of information. As I was mentioning earlier, when you want to look up an improvement activity, you get the full improvement activity description there in the shopping cart tool. You will also find our fact sheets. Our specialty guides are all housed there as well. And this is all located in the resource library on the QPP page. Next slide, please.
All right, next slide, please.
We'll now be turning it back over to Ketchum for the Q&A session. Thank you.
Great. Thanks, Angela. So as Angela said, we are now going to start the Q&A portion of the webinar. So to ask a question, please submit it through the Q&A box. And so our first question here is just asking about general participation what if we participated in 2017 but not 2018? How do we participate for 2019?
I would try to copy.
Hi, thanks for the question, Rose. There's nothing you have to do right now other than start collecting data, things that you would like to submit when the 2019 submission period opens in January of 2020. So you don't need to register or sign up unless you want to use, your group wants to participate through the CMS web interface. That, and if you want to administer the CAHPS for MIPS survey for 2019, those are the only two things you really need to register for. If you want to opt in to participate in 2019, we will have additional information coming soon about how to do that. But otherwise, you just you can go to our website, find our resources. We have a great quick start guide for 2019 and a lot of other more detailed information on how to start collecting data and different information now, so that when submissions for 2019 opens January 2020, that you'll be all set and have your information ready to submit to the program.
Thank you. And then we've also been getting a lot of questions on opting in versus voluntarily reporting. So when will that procedure for opting in versus voluntarily reporting be published this year? And how do people indicate whether they are opting in or if they're voluntarily reporting, and what's the difference there?
So the difference is that for clinicians or groups that choose to opt into the program, you will be considered an eligible participant of the program, and you will potentially receive a positive, negative, or neutral payment adjustment, as well as your final performance feedback and all of that information. If you just want to volunteer but not opt in, you'll receive all of that performance feedback information, but you will not be eligible for any type of payment adjustment, positive or negative. That's the difference between the two. And we will have some more information available as soon as we can about how the actual process will go operationally for opting in for 2019, but we don't have that information available just yet. But again, please sign up for our QPP listserv at subscribe on the main homepage at the bottom. Like I said, as soon as that information is available, we will provide a notification through that listserv, as well as posting materials on our resource library. Thanks.
Great, thank you. Our next question says, we've been unable to see the ACO performance feedback. We can only see a single TIN. Are others having this problem?
I'm sorry, that's actually not under the IA team's purview, so I think we would need you to contact the service center for that one.
Great, thank you. And our next question asks, can we no longer submit this information directly on the claims?
That is part of the submission types that you're able to do.
And if you go to the resource library again, there is a great fact sheet that describes everything you need to do for claims-based submissions. So it should provide you more detail in the resource.
Thank you. And our next question, this person says they're a solo practitioner and they have less than 200 office patients for Medicare, and they do see patients in the hospital for consults, so they are above the 90. Do I qualify for special status, and if so, how do we apply?
So again, I would need you to contact the service center to describe your scenario to them specifically to determine whether or not you meet the special status designation.
Great, thank you. This next question, this person says, I've seen the term MIPS profile in different publications. Could you speak to how improvement activities may fit into that?
Okay, thanks. So I'm not 100% sure what's being referred to for MIPS profile. If it's referring to your online QPP account where you can see your final performance feedback, that's the only thing I can think that term would be referring to, and that you access when you log in on the QPP website. You log into your QPP account, and if anybody on the line is wondering how in the world do I get a QPP account and how do I log in and find this information, we have a great resource guide on the QPP resource library called the QPP Access Guide, and that walks you through step-by-step how to create an account and how to access all this really important feedback information that would be available to you online. And I think the second part of that question, how does improvement activities fit into that? All of that information related to your improvement activities would be available in that feedback information.
Thank you. And this next question asks, is there anything wrong with putting the full year date range for the improvement activities category for all of our LLCs, or should it be specific dates?
No, that's actually perfectly fine. If you want to report for a full calendar year, we will accept it. We're not saying that it's limited to 90 days. Just 90 days is a continuous 90-day reporting period is what we require. But we will definitely accept more.
Great, thank you. And I'm seeing some questions about APM participation. So one person's asking if APMs automatically get the full score for improvement activities. And then another person's asking, they're saying that they were in an ACO last year and they didn't have to do improvement activities, but now they're in an APM. So do they need to do improvement activities this year?
If you are part of an APM, then you do not need to attest, but you will receive full IA credit. So in both of those situations, yes.
All right, and the next question asks, how does a provider in PCMH attest to their participation to receive full improvement activities credit?
On the QPP website, we have created the improvement activity ID, which is IA_PCMH_1, for you to select to attest to the PCMH designation.
Great, thank you. And our next question asks, can you continue to attest for the same improvement activities year after year, or do they need to be new, unique from the previous year?
Thank you for your question. Nope, you're able to attest year after year unless there are different instructions specified within the improvement activity. We do have a couple of improvement activities that you can only do once every 4 years, or I can't think of the other one now off the top of my head. But unless it's otherwise specified within the description, you are free to keep performing those improvement activities because that's how you will be able to measure your improvement. Thank you.
Thank you. And for our next question, if we could actually jump back to slide 30. This person would like us to explain again how it works if a quality registry submits your improvement activities attestation for a group.
So what you would do is you would either have the QCDR submit the specific improvement activities on your behalf, or you would have them, you would attest during the submission period using the login and attest submission mechanism. So you could have them do it for you on your behalf, but you probably would need to consult your specific QCDR to determine exactly how they do that for you.
All right, thank you, and we can go back to that Q&A slide. And so this next question asks, for 2019 group improvement activities, what percentage of PCMH participants need to have the PCMH status?
So it has to be 50% of the practice sites. Before it was at least one practice site within the 10, but it needs to now be 50% of the practice sites within a group's 10 need to be certified in order for you to attest and receive the credit,
Thank you. And this next question asks, do I need to report a separate 90 consecutive days duration for each improvement activity, or do I need to report a single duration for the entire category?
So that's really up to you. You could be doing an improvement activity, say, I'm just pulling one out of the air, EPA1, which is Expanded Practice Access. You might be doing that your entire year, so you would, put that in. You could put in that you performed that from January 1, 2019 to December 31st, 2019. Then you might decide mid-year to take up another improvement activity, and you perform it for the summer. So you could report for that particular time period, or to make it simple, you could just pick the entire year and then just put in the activities that you performed if they were covering that entire year. So if you had one, like I mentioned, that spanned the entire year and others dispersed within that year, maybe within different periods of the different quarters within the year, you could designate that entire year and report to us that way.
Thank you. Our next question is about registration. If we participated in 2018, is it required to register our practice again for MIPS on the QPP website?
No, you would use your same login.
Thank you. And this next question asks, does data collected only apply to Medicare patients or all patients seen in the 90-day period?
It's all payers, so that would be all patients.
All right, thank you. And we're just looking through our questions here. Let's see. So our next one asks...
Hang on one sec, real quick, while we're looking for our next question. Just want to clarify quick our last response. So you're not required to submit on all patients. You are required to submit on the Medicare patients, but you are able to submit for all patients.
Thank you. So this next question says, we will be reporting as a group. Do we have to sign up as a group submission by June 30th, 2019, like we did last year? And they note that they reported as a group, but they did not use web interface.
The only group registration that's required is if you're going to submit via the CMS web interface or you're going to administer the CAHPS for MIPS survey. So if you're submitting your data as a group, but you're not using CMS web interface, you're going to use a different submission method, you do not need to register anywhere.
Thank you. And this next question asks, for facility-based providers, do they need to attest for IA on their own, or would the facility do this for them?
If they're reporting as individuals, then they would report on their own. If they're reporting as part of the group, then the group would report.
Thank you. And this next question is asking about special status. So this person's asking, has this requirement changed between 2018 and 2019? Do people with special status need to attest to get the maximum available improvement activities points?
Nothing has changed as far as the policies concerning the special status designation. So the way it worked in the first 2 years of improvement activities for MIPS is how it will work for 2019.
Thank you. And I see another question regarding opt-in. Should we wait to opt in first before we submit improvement activities?
You have to opt in at submission.
Thank you. And on that note, what is the submission date for improvement activities?
Sorry, can you repeat that one?
Yeah, what is the submission date for improvement activities?
We don't have the exact date yet, but it will most likely be the end of March of 2020. The way it worked for performance year 2018, year 2, you had until March 30th, I believe, of this year to submit your data.
Thank you. This next question asks, if one provider in a group belongs to a non-MIPS APM, can the entire group claim the 50% of improvement activities points that are automatically awarded?
Can you repeat that one more time? I just want to make sure I'm understanding.
Yeah, and I think they might be asking about MIPS APMs and groups. So if one provider in a group belongs to a non-MIPS APM, can the entire group claim that 50% of improvement activities points?
So if you participate in any of the alternative payment models, you receive full credit for the IA performance category.
Okay, thank you. This next question asks, is there a file format requirement for the login and upload option? Is QRDA3 format required?
Hey, sorry, we're just looking over a couple things. Can you repeat that one more time?
Yeah. Is there a file format requirement for the login and upload option? Is QRDA3 format required?
I think we may have to take that one offline. I'm not sure if the policy has changed on that one. I don't want to give the wrong answer to this person. We need to verify that.
All right, and let's see here. I'm looking at all our questions. All right, so our next question asks to please explain the hardship exemption for small practices.
Hi, sorry, and is this the promoting interoperability hardship exception? Is that what you're...
And they did not say, so if that person wants to provide some clarification in the chat box real quick, we can keep an eye out for that.
Yeah, that'd be great, because I'm assuming that's what they're referring to. And if that is, we don't have our promoting interoperability SMEs on this call, but we do have additional information about that available on the QPP resource library.
Great, thank you. Let's see here. So I see another question on data submission. Do we only need to include the patient's name or the documentation per the patients, and how long do we need to retain our records?
What was the first part of that question? Before you said, do we need to keep the patient's name? What was the first thing you said?
Yeah, so I think they're asking about kind of the format of the data that they need to submit, and they're asking if they just need to have the patient's name or if they need to have documentation of the patients.
So the personally identifiable information can be masked, and we actually prefer that. And you would need to retain your documentation for 6 years.
Great, thank you. And on that note, do you have any examples of the data or documentation to be reported for improvement activities?
So I mentioned it during the presentation that there's a MIPS data validation criteria document located on the QPP website's resource library page. When you go into that document, there is a spreadsheet and a PDF for improvement activities, which outlines all of the data validation suggested documentation for each improvement activity. So I would suggest taking a look at that. You may want to review that before you select your improvement activities.
Great, thank you. And I think that is all the time that we have for the Q&A today, so I'll pass it back to Angela to close out the call.
Thank you. Again, I just want to thank everyone for taking the time this afternoon out of your busy day to listen to the Year 3 Improvement Activities policies. We hope that you found the information useful and that you will take advantage of the resources that we provide to give you more information and hopefully answer any additional questions that you have. Thanks again, and I hope you have a good afternoon.